Welcome to the deep dive.
Sure.
So today we're really looking at how to handle those really difficult bad thoughts.
Yeah.
The intrusive ones.
Yeah, the ones that just kind of pop in and stick around.
Exactly. We've gathered some practical techniques, things used in therapy. We've even got a detailed example and some pointers for parents, too.
Right. And the mission, I guess, is to pull out some solid ways you can maybe lessen the grip these thoughts have. Using mental exercises, building habits.
It's interesting because it's not about avoiding them, is it? It's more like engaging.
Yeah, exactly. Engaging in a way that over time makes them less powerful. Think of it like hearing a loud noise over and over. Eventually, you just don't jump anymore.
Habituation, right?
That's the goal, yeah. Habituation.
Okay, so first up, imaginal exposures. What's the deal with those?
Right, so this is where you face the fear, but you do it in your imagination. It's especially useful when real-life exposure isn't practical or, even appropriate.
Like for really tough stuff. Harm thoughts, sexual or religious obsessions.
Yeah, precisely. Things you can't or shouldn't act out. The idea is, by repeatedly focusing on the thought, intentionally, it starts to lose its charge. It becomes less triggering.
Makes sense. And a specific tool for this is the worry script.
Yes, the worry script. This is basically writing out your fear. You write a detailed story, first person, present tense, like it's happening right now.
Okay.
What you fear most if you, say, resist a compulsion or face something that triggers you. You need lots of detail where you are, what you're thinking, feeling, the ritual you're not doing, and then the catastrophe you're afraid of. Vividness is key.
We saw an example, didn't we, about expired milk?
Yeah, that one, it went into the sour taste, seeing curd chunks, imagining throwing up, missing school, failing tests.
Whoa, okay. That level of detail really paints a picture, doesn't it? It brings the fear right up close.
It does. That's the point, to fully engage with it. And the advice is to read this script regularly, like maybe 15 minutes every day.
Just reading it.
Well, reading it helps. Recording it can be even better. Using a strong, clear voice, not a timid one. Replaying that recording helps keep you focused.
Because the sound itself becomes part of the exposure.
Exactly. And look, if a script feels really upsetting, honestly, that probably means it's hitting the right spot. It's targeting a core fear.
But what if it's just too much?
You can adjust. Maybe start with a slightly less intense version, or break it down into smaller bits. Baby steps.
I also saw you could make them less scary at first, like using funny voices or apps.
Yeah, that can lower the initial hurdle, add a bit of distance or absurdity. Then, as you get used to it, you can ramp it up. Make new, more vivid scripts, maybe listen to them near actual triggers. Start with mild triggers, of course.
Right, like that case study with Sarah, sexual obsessions. She started reading silently, then aloud.
And then eventually used recordings while actually in triggering places, like school hallways or on the bus. It's a gradual buildup.
Okay, another technique mentioned was making an appointment with OCD. That sounds formal.
Yeah, a bit. But it's simple, really. You just set aside, say, 10 or 20 minutes each day, dedicated time.
To do what?
To deliberately focus on specific intrusive thoughts. Again, it's about habituation, getting used to them.
So you want to be near triggers, maybe have the fears written down.
Ideally, yes. And crucially, avoiding safety behaviors. Things you do to feel better for a moment. Even having a parent right there, while seeming supportive, can sometimes act as a safety signal and kind of hinder the process.
Gotcha. So this is different from just trying to delay the obsession, like putting it off.
Totally different. Delaying is postponement. This is direct, focused attention, active engagement in a controlled setting.
And it's important to remember, this doesn't replace facing fears in real life when possible, right? Like with contamination fears.
Absolutely. Imagining touching a doorknob isn't as potent as actually gradually doing it. Starting small, maybe just hovering your hand near it, then touching it with a tissue, that kind of step-by-step approach.
Okay. The sources also touched on something tough. OCD-related rage. These sudden, intense, angry outbursts.
Yeah, that can happen. Maybe when someone tries to stop a ritual, or just from the sheer frustration of it all, it can involve yelling, breaking things, even aggression. It's really hard, especially for parents.
How are parents supposed to handle that while still, not giving in to the OCD demands?
It's incredibly tricky. The key thing to grasp is that this rage is often extreme anxiety manifesting as fight rather than flight. It's not necessarily who the person is.
So what should parents do in that heated moment?
The recommendation is often to, try to passively endure it as safely as possible. Avoid negotiating or escalating. Don't get drawn into the vortex. The time to address the behavior is later, when things are calm.
Is there hope it gets better?
Yes. Usually, as the OCD itself is treated effectively, these coercive or rageful behaviors tend to decrease.
Good to know.
Mm.
We also saw a quick list of other imaginal tricks, like describing the obsession out loud, role-playing it.
Right. Or looking at related pictures, even singing about the feared image, or deliberately making it silly in your mind. Lots of creative ways to engage differently.
And you can combine these. Like,
Yeah.
read a burglary worry script after you've left the house without checking the locks 5 times.
Exactly. The goal there is to hit the obsession when it's active, weaken that link between the thought and the distress, right, in a real-world context.
So the big principle behind all these imaginal techniques,
Yeah.
what is it?
It really boils down to teaching your brain 2 things. 1, anxiety doesn't last forever. It does fade on its own, even if it feels awful. And 2, just having a thought doesn't make it real or mean it will happen. Facing it in your mind proves it's just a thought.
Okay, so recapping this deep dive, we've seen imaginal exposures, tools like worry scripts, and these OCD appointments offer structured ways to face distressing thoughts head-on, but in your mind. This lessens their power over time.
Right. And that key process is habituation, getting used to the thoughts through repeated, purposeful exposure.
Which leads us to a final thought for you, the listener. How might deliberately turning towards your fears, just in your imagination, actually change how you relate to them day to day?
Yeah. What could you learn about your own anxiety if you consciously decided to engage with the very things you usually push away? Something to think about.